Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is a doctorally prepared family nurse practitioner and leader of Florida State University's Lifestyle and Functional Medicine Doctorate of Nurse Practice program, DNP program, Alicia Craig Rodriguez. Dr. Craig Rodriguez is a nationally certified lifestyle medicine nurse practitioner, and she is FSU College of Nursing's Entrepreneur in Residence and Jonas Nurse Leader Scholar. As a former president and chief operating officer of two nationally recognized clinical research organizations, she's committed to advancing knowledge in the areas of leadership, entrepreneurship, and health promotion in clinical practice. She herself continues to practice integrative health with a focus on lifestyle and functional medicine, where she's dedicated to helping her patients identify the underlying triggers of their chronic illness. She combines pharmacologic and evidence-based lifestyle approaches to help her patients restore function and achieve optimal health. So Deborah and I are so excited to talk to her. We've been waiting for this conversation for a long time. So welcome, Dr. Ali. We really appreciate you being with us.
Thank you so very much. It's great to be here.
So I would love to start out with just knowing what your origin story is. Tell us a little bit about who you are and your current role, how you got to what you're doing right now.
Wow, that's $1 million question. I've had several careers in my lifetime, and this is by far the most exciting career. I actually started before I became a nurse. I was a flight attendant serving, very servant heart. And from there, actually found my way into the healthcare arena where I realized that I wanted to become a nurse. And so I did practice for several years and then found myself in the clinical research realm where I was assisting pharmaceutical drug companies in developing their blockbuster medications. Spent 15 years in that realm, and at that time thought that I was on the cutting edge of research and that I was doing everything for patient safety and care, only to realize after spending several years in that part of healthcare that was really only one tool in the toolbox. And yes, medications are life-saving, they're essential, they're needed, but there are so many other things that a patient can do to achieve optimal health. And a medication is not necessarily the first step in the order of operations. So I had an aha moment where at that time, I was president and chief operating officer of a company with many employees, very successful. And I had really achieved all that I could achieve at that stage of my life. There was really nothing more I can do in that company. So I asked myself, where do I want to spend, the next 10 to 20 years? And, what can be my legacy? And what is it that I really would like to leave the nursing profession before I retire? And I realized that I had been away from patient care for a long time. I was in the C-suite and really had gotten away from my roots. And so I actually reinvented myself in my mid 50s and went back to school. And after having been in patient care for 15 plus years, I went back and achieved my doctorate in nursing practice. And so I became a family nurse practitioner. And shortly after that, began practicing in lifestyle and functional medicine. That was really where my heart was. I've always been very focused on healthcare and most of the 6 pillars, if not all of them. And I joined Florida State University and began teaching in their family nurse practitioner program. Because I was an entrepreneur in my previous career, they really needed someone to teach the finance, economics, and entrepreneurship course, which was one that at that time no one really wanted to teach. And so I made that course my own and a few others as well. And I've just achieved so much fulfillment really watching these students begin the program, not quite sure of themselves. Many of them are baccalaureate prepared students going for their DNP over the course of 3 years. And watching them at the end of the program feeling empowered and knowledgeable and confident in really demonstrating their worth, whether it's interviewing for a position or really being a stakeholder within the healthcare system, advocating for patients. And back in 2019, I started to explore lifestyle medicine. And it was actually 2018 that I joined ACLM. And I really wanted to incorporate lifestyle medicine in the curriculum. And thankfully, I had leaders within FSU College of Nursing who stood behind me and were very supportive. At the time, we didn't know if the university would approve it because it was, quite an endeavor. But having a dean and an interim dean over the course of the last few years standing behind me, along with all of my other colleagues, it made that less daunting, and I stuck to it. And with the help of Kelly Freeman from ACLM, and also really looking at who has done it before, who has paved that path. And we know it's all about standing on the shoulders of giants. And Lily Tryon and her colleagues really paved the path. And I knew that if she could do it, that we could do it as well. And so we started writing the curriculum in 2019, and in the spring of 2022, the program, after several iterations, mind you, it was approved by the university. And so we launched the program. Our dean, my plan was to launch it in the fall of 2023, which is in a few weeks. And she said, "Oh no, Allie, I think we can launch it in the fall of 2022. So it was a little bit of a scrambling, building the plane as I flew it, because everything wasn't all written yet. So I was just constantly immersed in writing the curriculum. But we just finished our first cohort. And Susie, you have one of my students. They are on fire. They are passionate. They want to make a difference in their patients and their clients' health. And this is exactly what they were looking for. So they're excited and they're self-directed. And I'm having the greatest time really helping the next generation of lifestyle medicine nurse practitioners and other healthcare providers. We have a postmaster's certificate as well. So if you're not a nurse, but you want to get a postmaster's certificate and you have a master's degree in nutrition, or you're a physician assistant, or you're a psychologist, anyone who is in the healthcare field who would like to learn about lifestyle medicine, they can actually take the lifestyle medicine focus courses. So that's a little bit about me. I've done a few different things in my life, but this is what I love the most.
It's all culminated into what you're doing now, which is amazing. So, of course, I know Deborah probably has in her mind a number of questions. We prepared some questions, but we also have them as they come up. And so a couple of key things that came to my mind, there's so many, but initially when you started talking, you mentioned people that were standing behind you. Had you built some solid relationships within the School of Nursing before you started to do this. My perception is that it's a two-sided thing. You have the relationships and the forces outside of you, and then you have your own grit and determination in making it happen, right? So the marriage of those two things.
Yes, that is absolutely 100% accurate. I think people just have to know me to know that I'm very passionate about lifestyle promotion, and I'm that healthy deviant in the College of Nursing where I bring my own lunch and that kind of thing. And they know that I practice what I preach. At least I try. I'm a masterpiece in progress. I'm not quite there yet with all the pillars, but I think they knew inherently that this is something that we need. And we know the population is getting more and more unhealthy with every single year. And not only the medical model, but even the nursing model. The nursing curriculum across the country needs to change. We need to incorporate a little bit more health promotion in the way of the 6 pillars. We have a great course in health promotion, both undergraduate and graduate, but that's not enough. It's a semester, and it's just not enough. Nutrition was not covered extensively either. So the courses that we're teaching, we want to also create similar courses for our undergraduate students to make sure that they have that exposure as well. So I think, given my entrepreneurial background, I think it was important for all of the stakeholders at the College of Nursing to know that I was going to get this done, and that I was not going to give it up after 2 months, that I was going to take it to the finish line with their support. And so I had support not only internally at the College of Nursing, but with the American College of Lifestyle Medicine. Kelly Freeman provided so much support and affirmation and resources for me to really help me take it to the finish line.
And you're leading the way with this, because this is not in a lot of places in nursing schools across our country at the moment. So
it's not. I think Lily's program and my program are the only two, I think, DNP programs right now, although I suspect that will change, hopefully. But yeah, it was great and I feel very good about getting this accomplished, because sometimes universities can be a little bit intimidating. There's so many steps that you have to go through. And there were many iterations to make sure that the program had the rigor that it was required to have. And it's not an easy thing, but it's the right thing to do. I think it's the future of nursing, and I think it's the future of medicine.
Absolutely. We agree too. And if anybody is listening that is not aware of the other program that you're referencing, what other program is it that you're referencing? One other DNP program in our country?
It is Southern Adventist University is the other program. Yes.
Mm-hmm. And so it sounds like you made key partnerships within your school, outside of your school, and that really helped you. It seems like it took a little while to get
it does,
going,
and
but
it's still a work in progress. We have stakeholders in the community. I'm very excited to report that we will be opening up Florida State University College of Nursing. Okay. College of Nursing is opening up a nurse practitioner-led lifestyle medicine clinic.
Awesome.
Isn't that amazing?
That's so fun.
Yeah. So it'll combine practice, research, all kinds of things. So it's going to be a place where collaboration can occur. Students can practice and apply their skills. Faculty can practice as well. So our goal is to get as many of our faculty certified in lifestyle medicine so that they can teach the courses as well. Mm-hmm. So I never would have dreamed that it would have come this far so quickly. And I think that says everything about the support that I have received from FSU College of Nursing.
I love that. So you mentioned a couple of times about being able to bring some of this into the undergraduate curriculum. And maybe Deborah would second this, but we feel like the nurse practitioner role can be a little bit clearer when it comes to this, because we can prescribe. But
yes,
as far as undergraduate nurses, BSN nurses being able to support their patients too, either any thoughts about how you're going to try to infuse this into the baccalaureate level, or any comments about how that level specifically I think one of the confusing areas is nutrition sometimes.
Yeah. I think the first step, our plan is to create an introduction to lifestyle medicine undergraduate course utilizing the 6 pillars. It won't be at the same level as the advanced practice course, but it will have all of the components of and will meet the core competencies of the American College of Lifestyle Medicine. And so that's the first step. I also think that there is going to be needed a shift in healthcare, and that's not going to happen overnight. I think it's just a matter of continued persistence and perseverance and an empowerment of our nurses so that even though they're in the hospital setting at the bedside or in the community, that they're not at all intimidated by giving patients evidence-based handouts, resources, quick start programs for plant-based eating, those kinds of things. And these are endorsed by the American College of Lifestyle Medicine, which we know was a physician-led organization in the beginning. So I think that doing that and doing that consistently is going to make a difference. And it's always incremental steps. If you think about nurse practitioners and practice autonomy, it didn't happen in one fell swoop. It was incremental victories. And so I think we just need to take that to heart and know that it's not going to happen overnight.
And to come in on that note, what do you think have been some of your biggest challenges in any of this process?
The initial challenge, I think, was when I first started kicking this around and exploring, I call them discovery meetings with various stakeholders in the university. Not everyone was overly excited about it. So thankfully, I stayed close to home and stuck to the College of Nursing and didn't really branch out. But I think for me right now, the biggest challenge is to find places where our students can practice their skills. Susie, you had one of our students and you know how self-directed she was. Those are the kinds of students that we have, and they will be such great students to have in the clinical setting. And we're really trying to make sure that they find a practice setting where they're practicing lifestyle medicine, health promotion. And that is I think that's the biggest challenge for all programs, is finding preceptors. But I'm hoping and I'm optimistic that when our lifestyle medicine certified providers out there across the country, because our program is nationwide, that they will see that, okay, this is a student who I want to have, and we're empowering the next generation. We need to pave that path for them. And they have to have, in order to graduate with a doctorate degree, they have to have clinical hours. And because it's a degree in lifestyle medicine, they need lifestyle medicine focused clinical hours and projects. I know with my student, you had various projects that you were working on. That's fine as well, as long as it's focused in health promotion.
Thank you for sharing that. Yes, that does seem to be a perpetual problem, I guess. You said you stuck close to home, being in the School of Nursing. Have you collaborated with other colleagues or tested the waters with any other health disciplines?
I did. Yes, I did in the very beginning. And I think it was just bad timing, because sometimes my passion spills over. And at one point, another college in the university was really wanting to develop a mental health clinic. And we're doing that now with our new clinic, the College of Nursing. But at that time, it was really focused more on medication management. And of course, I was all about the gut-brain axis and all of that stuff. So it didn't come over as well as I had hoped. I am making headway into the community. And I think thanks to the ACLM meeting last fall, I got to meet some of the colleagues in Tallahassee and in surrounding areas. So I think it's a matter of really, now that we've got this program launched and I have a little more bandwidth than I had before, really getting out into the community and making sure that not only can we bring those providers, physicians, nutritionists, pharmacists, anyone who's really focused in lifestyle promotion, to bring them in collaboration with the College of Nursing and our clinic that's going to be doing research as well.
I love that. And when you said, just to clarify, I think I know what you're talking about, but for anybody listening who doesn't know, when you said the conference, you meant the American College of Lifestyle Medicine
Yes.
conference? Okay.
Yes, the American College of Lifestyle Medicine.
Okay,
Yes.
great.
We use these acronyms all the time.
Right.
Sorry about that.
It's good. The other thing, one of the things that we talk about sometimes with the people we've already spoken with is that how do we communicate the importance of these lifestyle medicine pillars to students and colleagues and stakeholders and all of this? And you said your passion spills over, which is great. It's just that consistent thing. I have felt the same thing out in my, I call it the standard issue primary care, where how do I get the other providers excited about using these pillars?
It's a fine line, Susie. It's a very fine line because you have to almost be a healthy deviant. And we know that nurses take care of everybody else and then they save themselves for last. And sometimes that doesn't happen. And I think in order for it to really spill over, you have to be a role model. And I try to be that role model. And although we have some people who may not embrace it now, I know they want to. We all want to feel vital and healthy, and we all want to be able to climb a flight of stairs and have energy and sleep well and all of that stuff. And the bottom line is nurses are burned out in many ways. And we've just come through a pandemic, and we all went through a lot of change and a lot of sacrifice. And so I think the most important thing we can do as a community, a nursing community, is to really embody those 6 pillars. And whether we've mastered all of them, that's okay. We're all a work in progress. But if we're showing that we're really standing behind those 6 pillars as really a very important, vital component of wellness, that's what nurses do. We advocate for our patients. And so we have to really serve as role models if we're going to expect our patients to stop smoking or to adopt a healthy eating pattern.
And do you have any success stories, either from a student as they're learning this stuff? I know that sometimes students will start to adopt some of these practices, or any student cases that you've heard, anything that stands out to you?
I just had my first practicum course with my first cohort students. And what makes me so happy is that they're applying their skills like in a very big way. Now, these are nurse practitioners anyway, so they're not green in terms of their training, but they're doing motivational interviewing and they're pulling out all of those American College of Lifestyle Medicine resources that they have in their toolkit, and they're using them. I had one student who said, I have an autoimmune condition, and I can't tell you this rotation. I have learned so much about my own health, and I just feel so optimistic about my future. Now, I have another student who is a pediatric nurse practitioner, and she's already implementing the American College of Lifestyle Medicine toolkit for pediatric obesity, and she's teaching medical students, residents, physicians, other nurses, nurse practitioners. And this is just the first practicum, the first rotation. So we all know that it's one thing to have the knowledge up here, but you have to know how to apply it in practice. You can't just put all those little resources in the drawer. You got to use them. And the only way you're going to do that is through clinical rotations. We also do something that medical schools do, and they've done them for years, and it's called the Objective Structured Clinical Exam, or OSCE. And we also do a FOSCE, which is a formative objective structured clinical exam. And this is where we use standardized patients. And this is an online asynchronous program. So we do this via like what we're doing now, but they actually have to go into a telemedicine encounter, and they're dealing with a patient who needs lifestyle interventions. And so they get to pull out all their tools, and then we debrief afterward where they get to watch themselves on video, and we talk about what went well, what are some things that you would do differently. And it's such a great learning tool to be able to get that muscle memory of what they know here and what they're applying in practice.
That's great. I know just for me, learning all this stuff myself, it takes practice and how you're going to phrase it and how you're going to streamline it and all of that information. So you mentioned a couple of times about tools, and the one you mentioned, the Pediatric Obesity Toolkit, if I'm remembering correctly, the ACLM houses something that is that toolkit, right?
Yes, that is correct. And there are several toolkits and resources that are already done and beautifully done. And just including things like the plant-based jumpstart guide, where you've got a grocery list and you've got pictures, and it's just wonderful to be able to have those at your fingertips and not have to start from scratch and write those.
Do you feel like that's the biggest resource pool, I guess I could say, or the biggest help for your students? Is that, or are they?
We've done a couple of other things. We've encouraged our students to become members of American College of Lifestyle Medicine, and many of them have. And we're also going to be in the future actually making that an expectation. We also started our first lifestyle medicine interest group at Florida State University. And it's going to be for not only our nursing students, undergrad and grad, but we're inviting everyone across campus who is interested in lifestyle medicine. And we're going to have guest speakers, and maybe we might do a little culinary meeting where we actually prepare some food, that type of thing. So lots of different ways to get everybody feeling comfortable and confident.
Right. Yeah, it takes a little bit, but it can be done. Lots of tools, it sounds like. So maybe I will turn it over to Deborah, who does a very nice job at summing up and bringing to light the subject of like the future of nursing reports and getting to our roots as nurses. So Deborah, do you want to take over?
Thank you, Susie. Before we started speaking, actually we had started that conversation. So maybe we can, I guess, a couple of things. I'd love to follow up and circle back first to part of the origin story that Susie asked you about. Might I ask what inspired you to, how did you first connect with all of this in the beginning? I think that we didn't necessarily hear exactly. It's really fascinating how people come to ACLM and lifestyle medicine. So I wondered if we might just touch.
It's interesting. I've always been lifestyle focused. I was a jogger before jogging was vogue, before all those fancy running shoes were vogue. But I actually found a news article on Lily Tryon. I didn't even know ACLM existed. And I'm a student of functional medicine. I've been practicing functional medicine, but I knew that the university wasn't ready for functional medicine. That's a little bit deeper, further away from the foundation of lifestyle. And so when I saw that, and I don't remember where, it was in some internet, I can't remember, but it was an article where she was like the first nurse practitioner to get certified by the American College of Lifestyle Medicine. So I was like, oh my gosh. Okay. So then I started, exploring, and I went on the website. I looked at certification. I looked at everything. I reached out and got to meet Kelly. And so that was really very galvanizing for me, because it gave me hope that I could implement a program that would not only be embraced by the university, but is really the foundation. It should happen before anyone goes any further, those 6 pillars. And so that's where I got my start, thanks to Lily.
Thank you for that. That's a wonderful share about that. Also, circling back to origin stories, and this is the origin of us, all of us as nurses. And Florence Nightingale in 1860 established the first nursing school. She saw nurses as professional, educated workforce, caregivers for the sick, and she founded the environmental theory. She focused on clean environment, clean water, good nutrition to promote healing, providing fruit as part of care. And with those things, those interventions, she was able to slash the mortality rate of the soldiers basically down to a couple of percentage points, from about over 50%, 60%. Here we are as modern nurses. We've come so far. We're leading universities. We're in as you said, the C-suite, and we are in the hospital setting, putting in central lines, really doing amazing things on so many levels. And yet, in some ways, when we look back, we are doing these amazing things. And yet I have this sense that in some ways we are losing touch a bit with our roots, and maybe in some ways the way physicians have, but nurses had a very deep roots grounded in the whole person. We know about physician heal thyself and medicine on the physician side, but nursing has always been centered on the entirely whole person. Florence Nightingale, Mary Breckinridge, we could go on and on. Didn't go out there with pharmaceutical bags and
Exactly. They were the first entrepreneurs. And I would argue that there was no greater innovation than hand washing. And we know that Florence Nightingale was responsible for that. And the thing about Florence Nightingale, and I use her as an example in my teaching, she grew up in a day where women weren't educated. They pretty much stayed at home, but she was educated by her father. And so she had that knowledge, because knowledge is power. She had the confidence to stand up at a time when women didn't speak up. And so I think we need to just take the word can't out of our vocabulary, because we can do whatever we want if we have the right knowledge. And I think we just need to always remember that.
Thank you. I love that. The competence and the confidence.
Yes.
So reflecting on National Academy of Medicine report, one in a series of major landmark reports coming out of Robert Wood Johnson and the Academy. This one, the most recent, and it is informed by the COVID epidemic, which shone a light on the social determinants of health. This one, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. Might we discuss that a little bit? And I'd love for you to just share extemporaneously about all of this with regard to nurses. The Future of Nursing report is really saying that nurses are the trusted bridge builders who champion good health for all. And it is exploring how we can and must unleash the power of the nurse to achieve health equity, and how the systems that nurses function within must do more to educate, pay, employ, and enable nurses to support nurses so they can do more. And you shared that nurses are already so burdened by what has happened and what we were leading up to, and then it was exacerbated by COVID. But given that report, might we talk a little bit about how do we get through this? How do we move forward in this?
That's such a good question. And I think the terms we can and must unleash the power of the nurse to achieve health equity, that's a very powerful statement. And as a nurse who has more years in her rearview mirror than the windshield looking forward, I would say it would behoove all of us to really spend some time to make sure that our new nurses are prepared. So that's where my mind is from an educational standpoint. We must empower them with the knowledge and the confidence. When we look at the new essentials, the patient has shifted from being a passive participant, basically taking orders, to really being an active participant who's really in the driver's seat. And so I think nurses are really the right healthcare provider to really help them. If they're going to be in charge of their own care, they need to have the tools, and they need to have that nurse championing them to really feel that they have the tools that are needed to be successful. And when I look at the essentials, it's interesting because they describe the engagement, this patient engagement, as the blockbuster drug of the 21st century. And that really resonated with me because I've spent a good amount of my career developing blockbuster drugs. And who better to engage our patients than nurses? Who better? There is no one better. We are with our patients, many more minutes than any other healthcare provider. If you think about it, we have more opportunities to engage with patients. And I think it's our responsibility. And if you look at the domains, domain 2 is person-centered holistic care. Domain 3 is population health. And then domain 10, which I think is so very important, personal, professional, and leadership development. And this is really promoting self-reflection in the nurse. Okay. We need to be able to self-reflect and really foster that personal growth and personal health, our own health as well, and really promoting well-being. I do worry about our nurses as they go out and they've got the stars in their eyes, and we just graduated 100 nursing students just a month ago, or 2 months ago, and my heart just goes out for them because I know they're going to have a little bit of a reality check when they go out there, but they're going to do fine as long as the seasoned nurses, those of us who have been doing this for a number of years, embrace them. And we're in a situation now where a whole generation of nurses are getting ready to retire or have already retired. And who is there to watch over them and empower them and lead them into their future practice? So those are my thoughts about building those bridges. I think it's up to us to help build those bridges for the next generation.
May I follow up on that with regard in particular to those hundreds and nurses that are going out there? I remember that for myself when I went out there and I was just ideal. I thought of all the ideals with which I was going out, and then the reality of what it was like on a large med surge floor and lacking of staff, dynamats you're waiting for, like all of that. Um, and when we look at that, and again, nurses that are passionate about the fundamentals of health for our patients, and more who are finding lifestyle, and whether it be through a movie or a website or somewhere, but more and more nurses are finding out about it. And they are passionate about implementing this in their practice, educating their patients that are being discharged when they're giving the discharge orders, or when they're helping them with their diet orders there. Can you share a little bit about what you would say, how you would be advising those BSN nurses when they go out about their authority to speak to their patients about about a healthy diet?
I think that this is where some of those skills that we teach in motivational interviewing, asking permission. May I share with you something that I think you might find helpful as you go home and prepare for your recovery, for example? I think if they've got those tools, they're more likely to use them and to employ them. But I also think it's going to be very important for our new generation of nurses to really reach out. And this is where we come in as well. We need to have more providers, whether they're physicians, physician assistants, pharmacists, nurse practitioners in the system, whether it's acute care, outpatient care, community care. They need to be trained in lifestyle medicine. And I think if there are physicians out there who are certified and who practice lifestyle medicine, cardiologists, for example, we need to somehow bring them all together in some fashion where they can be a like-minded community and know that they're not out there alone trying to promote lifestyle interventions when maybe everybody around them is not.
Yes, and I think that's one of the things that we see a lot with our members at ACLM with the bachelor's community is that nurses that want to educate their patients this way are often finding themselves taking additional training as moving out of nursing where and into coaching so that they can do it. And yet, as far as we can read, there's nothing that would prevent in the scope of practice of nurses to prevent a nurse from providing evidence-based education to the patient about nutrition. And yet the physician may be saying, I'm telling my patient to eat keto, or the dietitian may be saying, you're not authorized to speak to that. Are there things that you might share of what you would advise a nurse?
I would advise sticking to evidence-based resources, whether it's a book or a handout. I can tell you that I've been successful doing that, where you have a short visit, you don't have time to go over everything, but you give them homework. And I'm going to send you home with this handout, and I'd like you to read it. I've actually had thank you cards sent to me after I gave one patient a book called Digestive Wellness, Dr. Liz Lipsky, And this was someone who read it from cover to cover. And I didn't have time to talk to her about it, but I said, this is a book that really resonates with me. I think this will be very helpful for you. And she read it. And I think if you give someone something, that's a gift. And they may not look at it the first day or the second day, but if they've got this beautiful, colorful resource and they start to maybe feel like they need to do something, it's going to be there for them in their own time, in their own place. And even though you may not ever hear from that patient again, you've done something wonderful because you've given them that gift. So I think nurses just need to take stock in, you may not get that immediate gratification, but just know you're making a difference on a larger scale. And we just need to all be doing that to really change healthcare.
May I ask to circle back to the essentials? How do you think we're
Mm-hmm.
doing so far in our colleges of nursing? I'm sure you speak to other professors and other places.
I can speak for my college. Okay. We have been diligently working. We have revised our entire curriculum, but it's not all complete yet, undergraduate and graduate, aligning the essentials and all of the other guidelines that we need to follow. And even the lifestyle medicine curriculum is aligned with the essentials, but also the core competencies from the American College of Lifestyle Medicine. So we've been working very hard to do that. And I know other schools and colleges of nursing are doing the same thing. It's a very huge undertaking. And many of us had courses that hadn't been revised in several years. And so we're weaving those essentials, really picking apart the courses. We've changed courses completely, added new courses. And so I think we're in really good shape.
Wonderful. Might I, before I turn that back over to Susie, might I ask also any thoughts about the reimbursement model that we're dealing with and the ability of nurses to be not seen as a cost on the bottom line? And you have a long history and on the other side of things that really informs you as a leader and director, and how nurses, what if you had a magic wand for that, and what our reimbursement models are.
Yeah, if I only had a magic wand, what I have done thus far is, because of my financial background, I actually have an MBA that has given me that foundation, really helping nurses and advanced practice nurses to understand the business side of healthcare, the reimbursement side, and how you maximize reimbursement. And so the graduate course that I teach, we go over all of that: billing, coding, reimbursement, all the different types of payer systems and different payment models and all of that. The undergraduate, we are in the process of revising a course called Professional Perspectives that touches on that as well. And one of the transitions that we really have to address is when nurses leave the hospital setting and go into a reimbursement outpatient setting, or let's say they shift from the BSN bedside nurse to the nurse practitioner, they're taking off their nursing hat and putting on their revenue generator hat. And so they're moving from one side of the balance sheet to the other. And that's a huge shift in mindset, for one, but it's also very important for nurses to understand that shift and how they fit in to the business side of healthcare. And yes, in the hospital, they're part of what we call the bed and board. They're invisible. And so we have to find ways to make them more visible in all areas. I think even in outpatient, nurse practitioners are invisible because we're billing under the Incident 2 guidelines. The physician, they're billing under his or her NPI number. And so the nurse practitioners behind the scenes seeing the patients, but they're, from a quality metric standpoint, they're not recognized, unfortunately. So it's a work in progress, let's just say.
Thank you.
There's just 3 additional things. I do want to say just quickly about when I was looking at all the future of nursing, the latest report. I was watching a webinar that was put on by Columbia University, and there was a physician on there talking about how if he had his way, he would have those activities that are being done by baccalaureate level nurses to have some way of capturing what they're doing, a billing, a coding, a something that would capture all of what they're doing, because he said it's so important. And I thought, wow, that sounds like a really big job that's will take some time and some legislation and passionate people behind. But
wow, I don't know if you had a chance to listen to Rebecca Love, who was a plenary session speaker, and she's an entrepreneur in her own right. And I remember Johnson and Johnson. She was working with Johnson and Johnson, and they did a study in the hospital, and they were just trying to answer that all important question: just what do nurses do exactly? And so they did this study, and what they found was, and I can't remember the exact number, but nurses were like in 26 or 27 different places within the same hour. And they had so many workarounds because they had to be all things to everybody. And they were just constantly working in a system, excuse me, that it wasn't really designed. The workflow wasn't really designed for them. And so I think nurses do a lot of things that are not captured in the billing, just a lot of extra workarounds. I think that's a great idea.
Right. I do too. And I remember being queen of the workarounds. Like that was like the skill of the nurse, bedside nurse.
Yes, that's what nurses do. We're born innovators.
Right.
You know?
Right. So just a few other things. One is I'll list them off real quick, and then we can go through each one. One is your best way for staying up to date with the lifestyle medicine evidence. That's number one. Number two, which kind of go together, 2 and 3, which is there any other advice that you would give nurse educators who want to do something similar? And then if there's anything we didn't talk about that you think we should.
Okay. So how do I stay up to date? I'm a bookworm. I'm a little bit of a nerd that way. My husband always says, Allie, another book? You ordered another book? I love to read. I love to just improve my knowledge because I'm a work in progress, as I said. I also really try to focus now. I have divested some of my other extracurricular activities to focus on lifestyle. So when I'm doing my continuing education, when I'm reading articles, I'm doing it because I know that this program that we've developed needs to be updated. Some of the lectures I've done, I've already decided, oh, I forgot to put that in, so I'm going to go ahead and revise that. But I think it's important for all of us to stay up to date because the evidence is changing. One of the things that I really love about the training that I've received, both with the American College of Lifestyle Medicine and the School of Applied Functional Medicine, is that the evidence is very timely and up to date. It's not evidence from 2003. I see so many programs and educational opportunities out there that are not up to date. So that's really important to me. And so I try to carve out some time to do that, to improve the knowledge and make sure that I'm teaching from the most up-to-date evidence. Now, did that answer your question on that? Okay. And then as far as what I would say to nurse educators is you have to do a lot of discovery visits, okay, within your institution. You got to find out, is the timing right? What else is being offered? One of the things that I had to check because I had a little pushback initially, Allie, are you really going to add that course on nutrition? Don't you think that the College of Nutrition has comparable courses? And I said, you know what? I'm going to check on that. So I did, and they were different. And so I was able to solve that question. But just make sure that you've got buy-in. And I would start from your respective department, college, school of nursing, and then work your way all the way to the top because you will have to get approval from the highest level in the institution. And it typically involves several people. I had several iterations, just redoing the institutional effectiveness of what I was teaching. That's really big in the universities. Just be prepared for that. And just know that there are resources out there, including the American College and Kelly. Kelly Freeman was invaluable to me in terms of the resources that she provided, and all of my lifestyle medicine colleagues out there who championed this endeavor. So I think it's all about just having the right team behind you.
And then thank you for sharing that.
You're welcome.
Anything else that we didn't touch on that you think is an important piece that you want to share?
I'm just curious. I have a question for you, and I know you've been doing some interviews. Is there anything you'd like to share with me about what you're learning in these interviews?
Yes. So I feel like we have learned a lot. First of all, number one is all of the amazing things that nurses are doing. That's number one, right? They are just phenomenal people, both whatever. We've spoken to educators, RN, baccalaureate level, nurse practitioner level, DNP level. We've spoken to, and also leaders that are physician leaders and other lifestyle medicine leaders. And I think the biggest question mark point, which we've already touched on some, is nurses' competence and confidence in speaking about nutrition. So that is the biggest one. And I know for me, that does come up still. It still comes up, especially if I'm working in a place that has a dietitian and if that dietitian is lifestyle medicine trained or not. So there's that. And also as a bedside nurse, I don't think I would have had the confidence to speak about this unless I knew the resources and knew the evidence. So I feel like that's probably the biggest area, and making sure that we are able to provide guidance when it comes to scope, and just so that nurses know what their scope is. And Ps, it's a little easier, but RNs, making sure that they know what their scope is, they know what their state laws are and their regulations and all of that. The other pillars are pretty easy, but that one is the sticky.
It's the nutrition. That's a biggie. Yeah, it's a biggie. And it's interesting that you mentioned that because I've had two students in their doctoral project actually focus their project on healthcare providers' knowledge and confidence on nutrition, education, and preparation for practice. And it's interesting because the results clearly showed that physicians did not feel confident or prepared. Nurse practitioners, PAs, so we're talking the primary care providers out there, didn't have any, or if they did, it was just a teeny tiny bit of nutrition education. And it was really more about dietary guidelines and not really anything else. And so I think that nurses should take stock in that and know that they're not the only ones out there. And if they can come into the picture having that knowledge and confidence, maybe those other providers, especially physicians who maybe are giving them a little bit of pushback, can say, this nurse really knows what they're talking about. And they have all these evidence-based resources. It's just moving the needle slowly, and it's all about trust.
Yes. And I think as a nurse practitioner, I've modeled some because, like you, I'm always buying another book. My husband will say the same thing. Did you buy another book? And I'm like, yes. But I remember being at work one day, and it was still during the pandemic, and we were pretty much closed, but we still had a nurse that was helping us. And I had the book, How Not to Die, on my desk.
I have that.
Yeah.
I have that too.
So she was like, what is that? And she was this young African-American woman and just real vibrant, but she said she had high blood pressure. I said, you can take it, read it, read what you want. And so she was like, oh my gosh, that in the next week she had bought one for all of her family members. And I told her about nutritionfacts.org, and she was just like, she took it and ran with it. It was really fun to watch.
And that's a perfect example of lighting that flame and doing it in such a way where now that patient's going to light the flame with so many other people. And that's really how it has to work. That's right. Great. It's so funny. I have that book as well.
Yeah. And that was my Bible there for a little bit, and Deborah might have some other ideas about people that we've talked to. We've talked to a couple, and especially like Josie Bidwell, we spoke to her. She is doing the same thing with a nurse practitioner. She has her own lifestyle medicine clinic there at University of Mississippi. So it's really just fun to see how it's coming to life. And when we're all in it together, we're talking about it, we feel fired up. But my own personal experience is you go out and you feel like you're a little bit on an island because the rest of the medical establishment needs to come on board as well.
Yeah, it's so true. And it's interesting. I have a lot of patients who have a primary care provider. And because I only practice part-time, that makes sense because I'm not there every day. But it took some time, but I think now these providers feel very comfortable sending them to me because they know they're going to have something that they don't have time to provide. And they really appreciate it because when patients are educated and they know better, they do better. And it takes a team. I always tell my patients, you are the CEO of your health. I'm your chief motivational officer. You're in the driver's seat. I'm in the passenger seat. I'll give you directions, but you need to drive the car. And they do better that way because you can scare somebody to make a change for a little while, but eventually they're going to fall back into their previous habits because they just don't understand the why. And so that's where we come in terms of education, and nurses educate, bottom line.
Mm-hmm. Right.
And
I will say another observation that I've made is that patients are asking for it. They will say, I don't want to take another pill. So I know that they are asking for it. I've worked in a lifestyle medicine practice, and I call it the standard issue.
Yes.
And in both places, they want something different. They are asking.
Yes, they are. They are. And just a simple thing of just going over their lab results and linking that discussion to those resources on how can I move the needle on these labs? What can I do? Then they've got something tangible that they can go home and say, all right, I'm going to make a change here.
Deborah, do you have anything from our previous interviews?
We do have some champions out there in terms of physicians who are really utilizing BSN nurses at the top of their scope of practice in terms of shared medical appointments, developing content and materials in the clinic, and doing follow-ups. Really, there's a long history of that. There's a nurse from Kaiser decades ago, and Kaiser, we looked her up to see if she might still be with us, but she did pass a few years ago. But Kaiser had a clinic, and she was the person of record that was seeing the patients who had been identified as being at risk for many chronic diseases, and yet they didn't need a high-level intervention with a number of medications. So those patients would go to the doctor, and she would see them for their management and their education. And again, going back to our history, we do have those kind of models. But yes, ACLM, excuse me, thankfully, we do have some champions. Excuse me. I was going to ask very specifically, excuse me, I was going to ask specifically if you feel that a BSN nurse at the bedside in a hospital should feel completely confident and competent in providing to a patient an ACLM handout on nutrition or a flyer with a documentary on it like Forks Over Knives, or since it's not coming out of the college, what you might, with your knowledge of how this really works, boots on the ground, sending these students fresh out of college. And now you're going to have students at the BSN level that are really going to be getting this education. I can share that I teach in the MSN program of my alma mater, and I teach advanced pathophysiology. And I requested, this is a little bit of an aside, but I requested to build a lifestyle medicine course, and I was told we don't have room in the curriculum for it. So in my advanced patho course, I build in that curriculum. And I find, number one, that my students are so much more engaged as a result of this. They get so excited. They weave it into all their discussion posts. They'll say, and epigenetics and lifestyle medicine and lifestyles first. And so they're doing their own research on it and finding it out. And once I start cueing them and opening the door for that. I'm not seeing them at the bachelor's level. And you're going to be having bachelor students. Right now we have bachelor nurses that are at ACLM, and they have their diplomates or the new certificate that's coming out. But you are going to have bachelor prepared nurses that are being exposed to the power of lifestyle medicine. It's evidence-based. How would you guide them in terms of literature provided to a patient that they're discharging or that's coming in and they're guiding on their?
I think for discharge, I don't see any obstacles because that's the perfect time when they're getting ready to go home. They're overwhelmed. They're not going to take in those instructions. We all have been there. And so I think, may I share a handout with you that I think you're going to find very helpful once you get home and get settled. And it's a wealth of information. Now, at the bedside in the acute scenario where they're getting IV therapy and they're very sick and all of that's probably not the opportune time. But upon discharge, I think those BSN prepared nurses are in a really good position. And again, I think we have to empower these nurses, because I remember when I was in those days, I didn't want to do anything unless I got the blessing of the nurse manager. There has to be buy-in, and maybe we need to go out into the community and, present to these hospitals to let them know that there are wonderful resources at their fingertips. And again, it's all about improving health. They don't want rehospitalizations, right? Especially heart failure patients. The hospitals are evaluated on not having those patients get sent back to the hospital. So I think it's going to improve quality measures. And if we frame it that way, I think that it would be embraced. It's just a matter of enough people, enough nurses really pushing for it.
So it sounds that what you're saying is that a nurse, a BSN nurse, should feel fully within her scope of practice to take the nutrition handout from American College of Lifestyle Medicine and provide that to a patient that was just admitted or is being discharged or in a cardiac rehab unit or in a diabetes clinic where we know that still the practice is much more still about carb restriction and carb counting. And we know that it takes about 20 years for medicine to catch up with science. But what we're saying is you would tell a BSN nurse that she is within her scope to provide that information to that patient.
I feel, and maybe it's because I've been around the block a few times, but I think if you're looking at food as medicine, I think that's within their scope of practice. Okay. It's not like we're asking nurses to recommend certain drugs over another drug. That's out of scope. But I think offering options for eating healthy foods and staying away from pro-inflammatory foods or edible food-like substances, as we all know, the ultra-processed foods, I think that's absolutely within their scope. That's my professional and personal opinion. But I do, getting back to your thought just a little while ago where you were talking about shared medical appointments, I do think that model is going to really be a game changer, because it brings in that whole interprofessional collaboration and it gets everybody in the room. And I think that's what's been missing. We don't have medical students and nursing students in the classroom together, although certain schools of nursing have done that in simulation, which I think is excellent. I know State College of Florida does that. So we've got to get everybody, all disciplines together in the same environment so that they can truly simulate what actually happens in healthcare. And we want that to happen before they get into practice so that they understand that this is reality. And very often medical students enter practice without ever having done anything from an educational standpoint with nursing students. And I think that's a problem.
Yes. Thank you for that. Everyone is in their silos. And so it's sort of that whole idea of separate and unequal, that if everyone is over here doing it separately, it really doesn't build that trust, that respect, interprofessional respect and relationship and rapport of how you work together. Creation for what each person brings to that patient, that setting.
Exactly. And it's interesting, when I was part of that simulation as a student, when I was getting my teaching nurse educator certificate, the simulation environment had cameras on the ceiling and cameras in the side wall. And so during the debriefing, which is the most important part of simulation, I think, the medical students and the nursing students, we sat around the table, and you could see the nursing student when the medical students walked in, because they were the residents and the nursing students were the nurses. As soon as those residents walked in to the bedside, the nursing student retreated to the wall. and almost just gave up. And we had to talk them through that, saying, why did you step away? That is your patient, that patient. You just assess that patient from head to toe. You need to stay there. Do not leave the bedside, and you give them your assessment. But it's just that the way that we're socialized, the doctor walks into the room and, oh my gosh, we got to go over by the wall. So
I remember, I'll just chime in just very quickly. When I was a brand newbie nurse and I was working in a high level ICU, the chief of our unit every day would say, what do we have from nursing? He always engaged nurses to come tell me
love
what's
it.
going on. And was just, so I was raised up with a doctor who was bringing nurses into every conversation at the bedside. And I feel like I was very lucky in that respect.
Yeah, that you were very lucky, because that didn't happen. And it's really because, again, medical students aren't socialized to that environment either. And in fact, in that simulation debriefing, we would say to the medical student, can you tell me the name of your nurse? And they would be like, I have no idea. And so the medical school faculty said, don't you ever not know the name of your nurse, because that nurse is going to protect your license and is going to be the advocate for your patient and will keep you safe. And those are the kinds of things that are priceless. You can't put a price on that in educational training. And we just need to do more of that somehow.
That's really beautiful and powerful. Thank you. Yes, I love this scenario that you just painted. And one day, hopefully, all education will be that way, not just the one very special place or a few that are like that. That's the
I
way
hope
it
so.
be. Yes, thank you. Even one other last thing on the diet, which is really the sticking point, and it's the one where there's so much confusion everywhere, and there are points of where the nurse will have, say, our lifestyle medicine informed nurses would be having a different take on that based on the evidence than a physician who is not based in lifestyle medicine.
Mm-hmm.
And when we look back, I did an exploration of the NANDA diagnoses and the assessments, and there are absolutely assessments that have to do with obesity and different things, and they are interventions guiding on nutrition and diet.
Yes.
So it's so ironic to me that when we look at the origin story of nursing and how that was key and fundamental,
It was.
and then we look at our NANDA diagnosis, it's written into it. And yet today in 2023, when nurses are doing so much, yet being pushed off and told, and we have the NANDA diagnoses, and yet today are still many nurses are being told, no, that's not for you. You can't speak to that.
Yeah. It's hard to even wrap my head around that. And getting back to those who become certified, the baccalaureate in particular, nurses get certifications, and that gives them a certain additional credibility and credential. And so the credential of being diplomat or diplomat of ACLM should garner that respect in the clinical setting, that this person is certified to be able to speak about this, about nutrition and about other areas of lifestyle intervention. And every single guideline in the medical realm has lifestyle as the first intervention. So who better to cover that than the nurse, who spends more time with the patient than any other healthcare provider? So to me, it's very straightforward.
Thank you so much for your leadership and for encouraging and empowering nurses to be confident as they go out there, confident of their training, confident of their role as a nurse, an embodiment of this entire legacy, this beautiful code of ethics that that informs our practice, a very whole person approach that really, when we look at our current code of ethics, has all of the pillars written into it and ends with a line that says, nurses are called to heal the world.
Oh, I love that. Thank you very much. It's been such a pleasure to be with both of you. And thank you for inviting me. I really, I feel honored to be among all of these wonderful leaders in nursing.
You are a leader in lifestyle medicine and nursing, right? So you definitely have a seat here. So we appreciate so much the time you've spent with us. We really do. Thank you so much.
It was my pleasure. I hope to see you all sometime in the near future.